things. So before we actually get started, I have a question for the group on my next slide, if it would go to my next slide. First, though, our agenda, we're going to be talking about, again, some strategies, resources, and then there's going to be a chance and our opportunity for everybody to ask some questions if you feel like you need to. But first things first, I do have a question for the group. So to answer this, a little bit of IT support. If you go to, you're going to have a little bar on your screen that has like your microphone. It has like the share screen option, which you're not going to obviously be doing, but there's an annotate feature. If you click on the annotate feature and then click on text, then you can click on the screen and you can actually type your responses. Just make sure you click away from your text box so it actually loads to the screen. So if you'd like to turn on your microphone, you can. If you'd like to add your answer to the chat, you can do that as well, but you could also just like add it to the screen so everybody else can see it. So my question for you is, and there's no right or wrong answer to this is literally just like a personal question, but what gets in the way of feeling a sense of well-being? What are the barriers? What are the types of stressors that come up for you, not just as a student, but like as a person? What tends to get in the way of that when you do want to practice it, or you notice you need to practice it? What barriers, stressors? Again, no right or wrong answers, just when you reflect on your own life, what comes to mind? Loud and intrusive thoughts. Yes, absolutely. Just our own mind can be very meta. Expectations, absolutely. Stigma, social expectations. Yeah, there's a lot of, stigma attached to, our mental health and well-being. And, socially, we're trying to have more conversations about this, but it seems like we need to actually have more, and we need to have different conversations. It looks like someone's doing some drawing. Click on the text option of your annotate feature so you can actually text it and not draw out your answer. It'll take up like way too much of the screen. Unfairness. Okay. I'd be curious to know like what unfairness means. If you're open to adding more information to the unfairness, please do so. I'm also going to check the chat. Somebody in the chat wrote perfectionism. Absolutely, sir. Like our own expectations of ourselves can get in the way of practicing like our, sense of well-being or things that can help with our well-being. A lot of balls in the air, fear of dropping one or all of them. Absolutely, as students, you have a lot to juggle. It might feel like you just have to keep doing things a certain way, maybe even holding your breath. And you just can't let anything go. So you just keep doing what you're doing and hope for the best. Anything else? What gets in the way? Could even be finances. Absolutely. If you want to pursue treatment or pursue therapy, it might feel like it's too expensive, or it's just finances impacting our sense of well-being. It is really hard to focus on other things in life if we're worried about paying rent or affording groceries. And we all know in Toronto right now, rent and groceries are bordering inaccessible. Fear of dropping out. Yeah, absolutely. I'm going to check the chat again. Somebody wrote time management. You might just feel like you don't have time to do these things. A fear of not being able to cope. Yeah, sometimes it's more comfortable to do something difficult because that's just what we know. And seeing the other side of it can feel scary because it means we take a risk at doing something different, which means it's unknown, which means there's a chance it doesn't go well. And when things don't go well after we've tried, it tends to not feel very good. Somebody wrote future job opportunities, family hardships. Absolutely. I imagine if you're not from Canada and you've come to York and Ontario from a different country, that probably gets in the way. Just the fact that you're in a totally new environment, your friends aren't here, your family's not here, everything that you know looks totally and completely different. I'm just going to move some of your answers around so I can see everybody's. Oops, it's not what I wanted. I'm going to check the chat. Somebody wrote, I don't have the option to write to everyone, but only to you in, if you're having trouble writing, you can just put it in the chat, your answer, and I will read it out loud if you can't add it to the screen. Somebody wrote, finding yourself in a new environment. Yes, absolutely. maybe you haven't even moved from like a different country, but maybe different province, different city. Maybe you are used to rural living and now you're just in a really big city and it's really chaotic in Toronto. Institutions, yeah, just the structure of our institutions can make this difficult for sure. I'm going to give everybody just maybe one more minute. We're at 12:16, so maybe 12:17, and then I'm going to erase this and we're going to move on to the next slide. But anything else come to mind that makes this difficult? Somebody in the chat wrote the urgency of goals you want to achieve. Yeah, it might just feel like this is all I can do now. And if I do anything else, it's going to take away from this. And then I'm going to be really screwed. And I'm not going to be able to go back and make up for it. Sometimes it could also be a skills related barrier. Maybe we just don't know how to cope. Like Tom was saying, maybe you feel like you have these coping strategies, but they're not really healthy and they're not really getting things done the way you'd like to. So it might just be the skills related. I just don't know how to cope very effectively. No one's ever taught me that. My parents never taught me that. My friends aren't particularly great at it. I've never been in a place where somebody has actually been able to teach me how to do these things differently. Okay, as promised, it is 12:17, so I'm going to clear the screen and we're going to move on to our next slide. So we will have more like reflection opportunities to come up. And again, you're welcome to turn on your microphone if you'd like to. You can add to the chat or to the screen itself. So to get a little bit technical, how do we define stress? So stress can be situational. So a situation or event that puts pressure on us. So maybe you have a lot to do, you have a lot to think about, you have a lot of homework, you feel like you don't have much control over what's happening. You're sort of in the background of all these things that are happening in your life and you just kind of hope for the best, but it's a lot of stuff that's going on. It could also just be a reaction to being placed under pressure. So stress can be a response. It doesn't necessarily have to be a thing. It could actually be a pretty mundane situation, but it feels like we're being put under pressure and our interpretation of that event is that it's stressful. So feelings that we get when we have demands placed on us that we find difficult to cope with. So an example of this could be, maybe you have a friend, they're one of those people where they get like 5 hours of sleep a night. They do like 4 different jobs. They're in their program. They're pursuing diplomas and they just seem fine. And that's just how they manage in life. There's some people where that pressure doesn't feel so stressful, but perhaps for you, I know for myself, that would actually just stress me out. So again, it could be a situation, but it could also just be like our interpretation of that situation itself. So again, if you'd like to turn on your annotation feature, make sure you click the text option, and the annotate feature is going to be that little bar probably at the bottom of your screen, or you can put it in the chat. The question for you is, what effects of stress do you notice in yourself and others? What are the consequences or the symptoms of stress? What does it start to look like when you start to experience the stress in your life? Somebody in the chat wrote poor sleep habits. Absolutely. And then you're stressed so you don't sleep. And then because you don't sleep, then you're more stressed. It becomes this like really nasty, vicious cycle. Somebody wrote body temperature rises / gets, yeah, absolutely. You just might start to feel like really hot and you're like sweating, but you're not running. You're just sitting down and you're really sweaty because you're so stressed and anxious. Physical pain. Yes. We often don't acknowledge how connected chronic pain is to stress and anxiety, but there is an unbelievable connection between the two. There's lots of research on this as well. Procrastination. Yeah, you'd think stress actually would make us do more work, but sometimes it just makes us procrastinate. Actually, often it makes us procrastinate because the work makes us feel anxious and stressed. So it's like, if I just don't do it, then I won't feel stressed. But then by not doing it, we feel more stressed. It's kind of like the sleep cycle where it just kind of builds on itself and it becomes very cyclical. Yes, somebody wrote you feel more anxious. Bouts of irritability. Yeah, if you are really stressed, you're not going to have patience for other things. You're going to be agitated, irritable with people in your life. Somebody wrote confused. Absolutely. If you're really stressed out, it's really hard to think straight. It's hard to prioritize things. I'm going to check the chat. Somebody wrote eat too much or not at all. Absolutely. Appetite changes. A lot of physical sensations can happen. Somebody wrote like I shut down, and like shutting down can look like a lot of different things. It could be emotionally, mentally, it could be physically. I just can't get out of bed anymore. Somebody in the chat wrote lack of focus and lack of awareness of your immediate environment. Yes. Again, stress doesn't always push us to do more. It actually makes it just harder to do the things that we need to do to feel less stressed. So it has the opposite effect. Someone in the chat also wrote working overtime just to be able to survive in Canada and graduate. Absolutely. It maybe pushes you to do even more because there's maybe like this fear, like I need to get a job, I need to graduate, I move to this country, I put so much in this, I have to do well. So we might be like pushed to even do more with our time, which probably leads to more stress. Someone in the chat also wrote short-tempered. Yes, irritable, agitated. We just don't have a lot of wiggle room left for other things in life. I'm just going to read more. These are great answers, by the way. Thank you all. I'm trying to like get to all of them, but these are fantastic and keep adding more. We'll do this for maybe a couple more minutes. Somebody wrote headaches. Yeah, I like that people are acknowledging the physical symptoms of stress because those really we just don't notice them. They kind of get overlooked. We ignore them. We think it's always going to be mental or emotional, but absolutely our bodies respond to that stress. It's a lot of work for your body to feel stress. Somebody on the PowerPoint wrote adding to the paralysis through analysis. Yes, absolutely. The more we try to look into things, the more we analyze it, the more we realize there's all these steps. Sometimes we just step back and I just can't do it. I'm not going to do it. I can't do it. Brain fog. So somebody in the chat wrote brain fog. Yeah, it's really hard to think logically, clearly. This analysis paralysis comes up. Somebody on the slide also wrote chest pains. Yeah. Somebody wrote feeling ignored. That's an interesting one. I'd be more curious about that one. Maybe like 30 more seconds. Anything else anybody wants to add? These are fantastic though. You all have like covered like a lot of different areas that, again, we sometimes forget about. I'll take this a step further because I don't know if anybody mentioned it, but when we feel really stressed, it can impact our mood. So we might actually even start to feel depressed because it feels like we can't do anything. We might feel really frustrated with ourselves. And because we're not doing what we need to do or what we want to do, our mood can dip. And by virtue of our mood dipping, it's harder to do things, which means that our mood dips lower. So it can affect so many things in our lives. Okay, I'm going to clear a slide and we're going to move on to the next one. Thank you all for participating. That was fantastic. So again, as we've all noticed, because of everybody's responses, stress can affect a lot of different areas of our lives. It would be really nice if stress was one of those things where it could kind of just stay in like one box in one corner, and that's it. We can close the lid on it and we can kind of forget about it, but it's not what happens. I often have students coming to the counseling service asking me if they're allowed to talk about personal things. They say, am I only allowed to talk about academic related things with you because you work for the university? And I say, no. And there's no way we can separate those two things. If you have something going on personally, there's a solid chance it's going to start to impact your academics and vice versa. If academics aren't going well, it's probably going to start to impact your mood, that sense of stress, that sense of anxiety. And as we learned from everybody's answers, you're going to start getting chest pains. You're going to stop sleeping as much. You're going to start to burn out. So it would be nice if we could just put these in different boxes and have it not affect anything, but it'll actually start to affect everything in our lives. And that's not weird. It doesn't mean you failed at managing your stress. It's actually quite normal and it would be happening that way. So Tom was talking about coping. I was talking about coping. What is coping? This word gets thrown around a lot. I do peruse TikTok every once in a while, and I see what the younger generations are talking about with coping. I see a lot of different things out there. If we want to get technical, we don't have to stay technical, but if we want just like a definition to build on, cognitive and behavior, or coping is cognitive and behavioral efforts someone makes to manage. So managing can mean mastering something. It can mean to reduce something. So it could be to like reduce symptoms, or it could be to tolerate. When I hear the word tolerate, I think of like acceptance. Like there's some things in our lives we actually can't reduce or master or change, and we actually just have to practice like a level of acceptance for it. So it makes to manage or master, reduce, tolerate a troubled person environment relationship. Now you can tell this is a definition from 1985 because the term troubled person is used, which I don't think we'd use right now. But this is a good definition to work from and to build from because it covers a few areas. Again, it covers this managing piece, which can mean many different things. Managing something for you is going to look different from how I manage things and how your friends do and your parents and everybody else in your life. It doesn't mean that the way we manage is bad or wrong. It just means it's different, and people need different levels of managing. Even when I think about coping, like Tom mentioned, like bad coping, people might label like alcohol as bad coping or drug use as bad coping or like avoidance as bad coping. I actually wouldn't call any of these bad coping. They're probably not helpful. They're probably not healthy. In the long run, it might not actually help you take care of the issues in an effective way, but they're not bad. We tend to use our ways of coping for a reason because we've learned them from somewhere. And at some point it made sense to do those things. So when you think about coping, it can be very cognitive. So it can just be like mental strategies, trying to talk yourself out of things, trying to manage those intrusive thoughts, but it can also be very behavioral. You can actually put things into action. And I really encourage folks to pay attention to that behavioral piece because sometimes when the mental stuff is not moving, it's because we need to practice something physically different. So my question for you again, if you would like to turn on your annotate feature, make sure you click the text option or you want to use the chat box. My question for you is what actually helps? Okay. What are the strategies for coping that you currently use? And again, there's no right or wrong, but like whatever helps. Is it like sleeping through something? Is it like avoiding stuff entirely? Is it, talking to your mom or your friend or your partner? What tends to help you? And again, it's not good or bad. Like some people, I use substances. That's what I do to get through my day. And we're not here to judge that. If you're open to sharing it, you can, but you don't have to. So there's no right or wrong with this. It's whatever kind of comes to mind for you. Somebody wrote venting to someone. Yeah, sometimes you just need to like sit your friend down and say like, can you just let me like babble for 5 minutes? I just need to get it out of my system. Somebody wrote thought records with balanced thoughts. Yes, like a very technical CBT way of approaching it. Somebody drew out sleep. Yeah, sometimes you just gotta sleep, avoid it, get through it. Early nights, early mornings. Yeah, there you go. Just the sleep again, like prioritizing snoozing, incredibly important. Earplugs. Yeah, if we're feeling overstimulated, maybe we need earplugs. Somebody wrote exercise. Absolutely. Exercise is one of those things where we like to talk about it a lot, but like in a really unhealthy kind of way, because it's always related to like weight loss. But exercise and mental health is like so commonly studied, and over again, the research is like, yeah, you need to exercise just to feel okay. Taking a mental health day. Yeah, just taking a day off, just like you take a sick day if you had a cold. Somebody wrote, seek help with counseling specialists. Yeah, talking to a professional. If you feel like you can't talk to a friend, can you talk to a professional? I think somebody wrote, I just have to sort of rejig my screen a little bit. Somebody wrote daydream. Yeah, again, not good or bad. Sometimes we just need to fantasize about something better in our lives, and that just helps us feel okay, or helps us get through something that's really challenging. I'm going to check the chat because I think it's going directly to me. And I want to make sure everybody can hear this. Taking a walk that's harder in the winter. Oh my gosh, it's harder. And it's like snowstorming right now. But yeah, taking walks can be like very helpful. If you can get to a gym and do this, York has a gym. You can do it that way, but walking in nature tends to be really nice. Somebody wrote asking someone for help. Yeah, friend, family member, professional, maybe even like a supervisor. Like if you don't know who to go to, can you ask your supervisor to direct you? Somebody wrote, I pace and talk to myself out of reflex. If there's no one to talk to, I do the same. I think we all have like shower time arguments with nobody who's there. And they also wrote, do some physical activity like skating. Absolutely. So there are some winter things we can do. Somebody wrote, practice mindfulness. I love that. I think practicing mindfulness is very important. We will talk about that. Eating things to boost your mood. Yeah, absolutely. Sometimes just having like a really delicious food item can bring up our mood. And then we kind of feel okay. It might not deal with like all the problems that we're dealing with, but it just helps boost some endorphins for a little bit. Okay, so why don't we do one more minute on this slide? I'll see if I missed any. Maybe even thinking to yourself, are there any ways of coping that you've tried that just don't work? Like you've heard from people that it's a great idea, you tried it, you realize it's not really your thing. Anything else? Maybe you have like a pet, hang out with like your kitty or your puppy, just like paying attention to how soft they feel, like a very mindfulness approach to it. Looks like someone's adding shopping. Yeah, absolutely. It's a great way. Again, it's not right or wrong. It's a way to boost endorphins and to feel good. Ooh, someone in the chat wrote a relaxing bath. It's a great way to do self-care. Okay, I'm going to delete all of your wonderful answers. Thank you, everybody. These are fantastic. So it sounds like most people have been trying something in some capacity. And again, these are not right or wrong. We just cope the way we know how to cope, and that's okay. And it's important to also like think about, is there maybe something I can do differently? But we don't have to shame ourselves into doing things differently. So in terms of like actual coping strategies, we're going to talk about some relaxation skills. I want to be very cautious with how I approach this though, because again, social media, TikTok, Instagram, there's a certain way people talk about relaxation skills that I find it's not a very accessible conversation, and it tends to sound futile for a lot of people, and it makes people feel like they're doing something wrong because the relaxation skills just somehow aren't working, or they don't feel as effective as everybody else seems to be claiming. So I try to be cautious about these conversations so we can bring it a little bit closer to home instead of talking about it in a way where it almost feels like this mysterious thing that we just can't do. So we're going to talk about it in a very practical manner. First things first is breathing. So this is why I prefaced all that, because social media, friends, often people are talking about, oh, you practice deep breathing. Deep breathing works for some things, but doesn't work for everything. Is it going to make every stressor or anxiety inducing situation go away? Absolutely not. But deep breathing is imperative. It is very important. Deep breathing, it sort of activates this thing called your vagus nerve, not Las Vegas, but like VAGUS. It's this nerve that is responsible for triggering something called your parasympathetic nervous system. You do not have to remember that. It's just a fancy word, but if you want to Google vagus nerve, again, it's not Las Vegas, it's VAGUS. This is the nerve responsible for letting our body and our brain know that we are safe and we are okay. It's this like switch that goes off. It's like, oh, there's no danger. There's no bear chasing me. There's no lion. Nothing bad is actually happening in my environment. We don't want to only practice deep breathing when we're feeling really stressed. So this is the mistake folks sometimes make, and you're not wrong for it. It's typically not explained very well, but you do have to practice deep breathing when you're actually feeling okay. And I have a really fun analogy that I often use to explain this. So when you think about like firefighters, for instance, okay? Firefighters, it is literally their job to do very dangerous things and to run towards danger instead of away from danger. Our instinct is to run away from it. Firefighters have to go into it. So you can imagine how terrifying of a job it is. Even though they get paid great, it's a terrifying job to run into a burning building where it's chaotic, people are screaming, it is really terrifying. Firefighters aren't special people. They're just people who have practiced movements over and over and over again to the point where they don't have to think about it. They don't wait for a burning building to practice going into a burning building. They practice it hundreds of thousands of times over and over again. How to put on my suit, how to put on my helmet, where do I sit in the fire truck, who's in charge of the hose, What do I need to do when things start to go wrong? It becomes like muscle memory, because in those moments of chaos, when the building is burning, we do not have time to think. We just have to do something. So I encourage you, if deep breathing is something you've heard of and you feel like you've tried, but it like doesn't work, it might actually just be the fact that you need to practice it when you're feeling fine, just like a firefighter would. So in these moments where you start to feel so stressed or so anxious, you feel like you can actually pull on those skills. You can practice these like big, deep belly breaths. You can initiate this vagus nerve response, and your body can hopefully start to calm itself down. It's not about practicing it for an hour once a month. It's about practicing these things as often as possible. You do it for like 15 minutes a day. Just breathe in, you breathe out. You can follow some structured things to do that. Do it while your coffee is cooling off or you're waiting for something. Maybe you're waiting for transit, and just give yourself a moment to practice that breathing. You put your hand on your chest, you can put your hand on your belly to make sure you're actually doing it correctly. You can include a meditation, you can include some sort of imagery, but ultimately you just want to give yourself consistent practice with breathing. So you can teach your body that it's okay, because when we're panicking and we're stressed, usually we're breathing like, we're taking these like little quarter breaths. And those quarter breaths continue to tell your body that something bad is happening. So deep breaths, kick in that vagus nerve, kick in that parasympathetic response, let our bodies know we're okay. There's not anything bad happening. There's no bear, there's no burning building. Deep breathing has a lot to do with mindfulness. They're different things, but they do go hand in hand. You can like practice deep breathing, but not necessarily practice like formal mindfulness, but you sort of are in its own way. And a lot of people misunderstand what mindfulness is as well. So that's why I thought it would be really helpful to talk about this, because again, social media tends to skew what these things actually mean, or just doesn't give us like the best information. But really, mindfulness is being in the here and now. I love this quote by Jon Kabat-Zinn. Jon Kabat-Zinn, he did not invent mindfulness. Mindfulness is like a very ancient, worldwide practice that's very important to many cultures. Jon Kabat-Zinn just popularized it in North America. I think it was like the 60s or the 70s, but he did not invent it. You might Google his name and it'll say he invented it, but we're not going to give him that credit. Jon Kabat-Zinn's definition really encompasses what mindfulness meditation is. So he defines it as the awareness that arises through paying attention on purpose, in the present moment, non-judgmentally, in the service of self-understanding and wisdom. So the main components are we're paying attention, but we're doing it purposely. So we're setting the intention to pay attention to something. It's always present focus. We're not paying attention to something 5 years down the road or 10 years, something happened 10 years ago. We're also not doing it judgmentally. That's the piece that people tend to struggle with the most. When I talk about mindfulness with the clients that I work with, very often people tell me, well, I tried mindfulness and I was just frustrated the whole time because I'm so bad at it. It's not that you can't feel frustrated when you're practicing mindfulness. It would be normal to actually experience frustration because it's a very hard thing to do. But what we want to be careful of is, how are we talking to ourselves when we feel like we are not doing it the way we wanted to do it? That is the kicker here, is are we doing it in a gentle, objective way, or can we allow our brain to walk off and then instruct it to come back? That is the essence of mindfulness. It's noticing that your brain is going to some faraway land, again, 5 years down the road, 10 years in the past, and it's just noticing. It's going, oh, I went there. That's interesting that I went there. Can I come back to my breath? And what's going to happen is your brain is going to get up and it's going to walk away again. And then you're going to bring it back and it's going to do it again and over and over and over again. And you'll do it for like 15 minutes or however long you're practicing your meditation. People think that means you're doing bad meditation because you can't turn your brain off. You're not supposed to turn your brain off. So long as you're alive, your brain is always going to be on. If it was off, you wouldn't be here anymore. But it is literally just the process of bringing yourself back to your body and back to the moment. It's kind of like doing a bicep curl. If you want to build like big bicep muscles, you have to keep curling. You just got to keep doing it. You can't think about doing it. You can't do one and hope for the best. You got to do it over and over again. And there's going to be some days where your mindfulness practice is going to feel so painful and frustrating, and you're going to feel like every noise is bothering you. And there's going to be some days where it's very relaxing and it helps you stay grounded, but there's no right or wrong experience with practicing mindfulness. So mindfulness, again, it is a practice, a way of being centered around being in the present moment. It's called a practice for a reason, because there's no end goal. There's no getting to like a Zen master level. There's no like, belts or like structure to the system. It's something that you always do. You never get to an end point, and you can always do things differently as you go through it. So practicing mindfulness can help one foster overall well-being, patience, resilience, and self-acceptance, as well as aiding with cognition, memory, attention, and concentration. This is proven by evidence and research. I really like mindfulness because it's not just something that sounds good and feels good, but because it's actually supported by so much evidence. If you're ever curious, Google mindfulness meditation, go to Google Scholar. You're all grad students. I know you know how to look these things up, and look to the literature. If it feels like it's not very convincing, just go see what the evidence suggests. And it suggests all these things. It's been studied for a very long time, and over again, outcomes with these studies, they're replicated over and over. It's fantastic, not just for, again, the well-being and the self-acceptance, but there's also a lot of research on mindfulness in relation to chronic pain. So mindfulness practices, again, paying attention, bringing awareness. We're not judging ourselves. We're not judging our breaths. Sometimes people do that too. Oh, I don't breathe right. It's like, well, that's a judgment. You're probably actually just breathing. We're paying attention to our body. We might notice some sounds that come up. Toronto's a pretty busy city. Probably going to hear a lot of things, and just noticing thoughts as they come to us, because they will come to us. You're going to think about what you had for lunch, and then what you did last year, and what your friends said over the weekend, and you're just going to bring yourself back. It can be short. So oftentimes there's this misconception that mindfulness somehow has to be practiced for like an hour or two every day. You don't have to do that. Again, I'm going to reference the research and the literature. Literature does suggest that 15 minutes is a really nice number to meditate. You can go as low as 5 minutes, 10 minutes, 15 seems to be a really nice golden number in the research. So it's really not a long time. And again, it's sort of like going to the gym. If you go to the gym once a week and you want to get like a six-pack, you're probably not going to get a six-pack. It's not even enough to go to the gym and stand outside of it and to just look at it and be like, oh, if I think really hard about getting a six-pack, maybe I'll get one. You probably will not. If you do, you're a medical mystery, and you need to email me, and we need to email some like very high up people in the world. But it's not possible to get a six-pack from working out once a week. It's the same with meditation. We can't just do it once a week and hope for the best. We can't do it for like 2 hours once a month and think that's going to like help us in the long run. Really, it's the frequency that counts with meditation. You want to do it as often as possible, once a day, 15 minutes, be consistent. If you miss some days here and there, not a big deal. We want to be gentle about this process, but the more consistent you are, the better. It's something you can plug into your schedule. Just make it a part of your morning routine. You can even practice mindfulness while brushing your teeth, while making your morning coffee if you're a coffee person. Or I know some people said the way they cope is going for walks. What would it be like to do a mindful walk? Have you ever really paid attention to what the leaves sound like, what your footsteps feel like, what snow feels like under your feet as well? What does the coldness feel like on your nose? Have you ever even paid attention to that? And we're paying attention in a non-judgmental way. We're just noticing it and describing it to ourselves. Just gonna check the chat really quick. Someone's asking if we're gonna have slides. Yes, you are gonna get all these slides. So don't take notes, just sit back, relax, take it all in. You can practice many different exercises. There's a lot of different like mindfulness meditation activities that you can do from all over the internet. Just gonna point out some of them. This is a grounding technique. This is really helpful if you're feeling like particularly distressed. Maybe even you feel like you're kind of floating outside of your body because you're just like so anxious and stressed out, like your skin starts to crawl and you're feeling like really yucky. Grounding is fantastic because you're re-engaging your senses. So when you're really stressed or you're really upset, what also happens, and this is like technical, so you don't have to remember it, this front part of your brain that gives you the capacity to make like fantastic decisions, to judge things, what makes us different from animals ultimately. When we're really distressed, that tends to turn off. So if you want to do some like really complicated methods of coping, you might not be in the place to do it effectively. And then what's going to happen is you're going to think, oh no, I can't take care of myself because this thing didn't work. And my thought would be, well, it wasn't supposed to work because your brain wasn't even in the right place to do it. But grounding can be really useful. This is just a way to re-engage your senses. And again, if we go back to this idea of like firefighters practicing things before they go into a burning building, practice this when you feel fine. So in the moment where you feel really stressed out or anxious or totally distressed, that activity and just like the process of going through this just feels a little bit more accessible, so you feel like you can do it effectively. But again, grounding is very much supported by research. It's very effective. You're noticing things. What do you see in your environment? What, 5 things that are shaped like a square. Touch 4 things, describe it to yourself. We're not judging it. Can you hear 3 things? Can you sort of snap in your ears? 2 things that you can smell. I have some like cold coffee on my desk. Take a whiff. We're not judging it. It just smells like cold coffee. And do it over and over again. Breathing while you're doing it as well. You can do something called visualization. This one is called Leaves on a Stream. You can do this yourself. Like if you just want to sort of like go through a daydream or visualization, I find it actually more useful to listen to a guided visualization. They are really easy to find on YouTube. There's actually a YouTube channel called Calm. It's CALM. You may have heard of the Calm app. It's very expensive. It's like $80 a year. Usually they'll give you a discount if you sign up for the free option though, but they have a fantastic YouTube channel where they put a lot of meditations there for free, and they do have visualization meditations. This can be really helpful if you are like a daydreamer, you have a great imagination, and maybe just like going somewhere else temporarily is just really relaxing for you. Again, some people love this, some people don't, but it's something you can look into and you give it a try. Give it more than one try, and if you really like it, you can stick with it. If you don't, you can move on to some other sort of mindfulness practice. So we're going to move on from mindfulness meditation. We're going to talk about some cognitive strategies. Somebody also asked a question. I'm actually going to maybe wait for to answer questions at the end of the presentation, because if I keep checking our chat, then it's going to like throw me off track, and then I have a hard time recalibrating. So if you have a question, we will do a Q&A at the end. We're going to talk about some cognitive or thought-based strategies. Cognitive or cognition is just a fancy term for thinking. We're going to talk about something called CBT. There's no CBT written on here, but this is basically the essence of cognitive behavioral therapy. I know somebody earlier on was saying they do thought records. So there's somebody here who's familiar with CBT. So maybe you've heard of it, maybe you haven't. It's very popular. It's been the flavor of the past like 2 decades within psychotherapy and psychology. So you might understand it, you might not. But really, all CBT is this idea that we have thoughts, we have behaviors, we have emotions, and we have physical sensations, and they tend to all interact with each other. And the reason why all the arrows are going in different directions is because it doesn't necessarily have to start with one of those all the time. If I think about somebody who's living with panic disorder, for instance, you might not have to have a triggering event happen. You might not have to experience a thought. You might just notice that your heart is beating really fast. And your thought then might be, oh, my heart beats really fast when I'm having a panic attack. Oh no, oh gosh, oh no. Am I now having a panic attack? And then a panic attack is induced. So sometimes it can just be a physical sensation. An example I really like is, let's say we're going into work or we're going into our workspace or whatever it might be, and we say hi to our colleague, Steve, and Steve doesn't say hi back. Our first thought could be, oh my gosh, Steve hates me, and Steve is friends with Megan, and they're friends with Allison, and I bet they all hate me, and they're all talking about me, and I'm not going to go hang out with them after work. We're supposed to have like a work dinner event, and I'm not going to go because those people all hate me and I'm just a loser and nobody likes me. So I'm just going to go home and isolate. By virtue of isolating, we probably feel worse about ourselves and we'll probably think worse about ourselves. But if we take a step back, say hi to Steve, maybe our first thought, instead of that Steve hates me and everybody hates me and now I can't hang out with anybody at work because they all hate me, maybe our first thought is, maybe Steve had headphones in. I'm just going to go say hi to him later. Just didn't hear me. That was it. Or I know Steve is going through a divorce right now, and maybe he had a really rough night. Maybe he just doesn't want to talk to anybody because he's not going through a good time. Could also be that I don't actually like Steve either. I know Steve doesn't like me. I don't even like him. So I don't really care. I'm going to still go to my dinner with my colleagues and I'm going to have a good time. Steve's going to be there. We don't really get along, but I've managed up until this point and that's okay. So it's not even necessarily that like our thoughts are like they're bad and they're awful and they're just like out to get us. In some situations, it's that they're just really trying to be protective. We're worried about people not liking us. We're worried about failing. We're worried about people thinking we're stupid. So it's like, okay, I'm going to back off then and I'm going to avoid it. I'm not going to do anything about this because I don't want to feel these things ever again. So they can be very protective. They can be, depending on the environment, they might feel worse than usual. But it really is just like our perception of our mood, perception of our body sensations, perception of the situation at hand. And then we tend to either think or behave in a certain way that continues this cycle. So there's different types of like mindsets that we can also operate from if we're thinking about like different cognitive or like thought related strategies. If you've ever reached out to the Learning Skills Center talks a lot about fixed versus growth mindset. A fixed mindset, I'll just read from the slide. It can mean like intelligence, character, and creativity are fixed traits that cannot be effectively changed. It could be that success is dependent upon inherent intelligence. Talent alone creates success. Effort plays little, if any, role in success. So it's a very rigid way of thinking. A growth mindset is acknowledging that intelligence is just the beginning. Failure is not evidence of unintelligence. It signifies a lesson learned and opportunity to grow. It could mean that basic abilities can be developed through dedication and hard work and fosters a love of learning and resilience. It's not that growth mindset is always good and it's the best. And if you have a fixed mindset, you're bad and you're wrong. That's not what this is saying. It's just giving you an opportunity to reflect. What kind of mindset do you typically operate from? Is your fixed mindset only for you and then everybody else gets a growth mindset? Like your friends can make mistakes, your friends can work hard and get better at things. Everybody else in my life has the capacity to be flexible, but I have to be this way and that way, and everything is rigid and black and white? Or do you have a growth mindset for yourself, but you tend to be very rigid with other people in your life? So it's not about berating ourselves or judging ourselves for how our mindsets work. It's just about bringing in awareness to it. And can we do things differently? If we find that we're always telling ourselves that success is just dependent on my inherent intelligence, can we bring some awareness that can we change it? Like, how do we know that's even true? Because it's probably not true. And it's probably actually holding us back in a lot of different ways. Within CBT, there's something called a thinking trap. I love thinking traps. Not that I like doing them, but I think they're fantastic to learn about. Because it just helps us bring a lot of awareness to the way we think. Again, thinking traps are not bad. There's nothing wrong with you if you do them. We all do thinking traps. It's just about bringing in awareness and how can we do differently. So it is based on the work of Aaron T. Beck. And Aaron T. Beck, he founded cognitive behavioral therapy. So he came up with all the good stuff. It can also be referred to as like patterns of limited thinking, cognitive distortions, thinking errors, stinking thinking. I think stinking thinking is from... it's from some TV show that I'm not remembering the name of. Ted Lasso. There we go. He calls thinking traps stinking thinking. If you haven't watched Ted Lasso, it's a fantastic show. Incorporate like a lot of therapeutic discussions in it, oddly enough, because it's a show about soccer. But so thinking traps can be thoughts that seem plausible. So they seem very real. They're not just like ridiculous thoughts that are so unbelievable. They probably have like a certain level of belief attached to them. So that's why they feel so catastrophic or like distressing for ourselves. They're usually connected to negative feelings. So cognitive distortions aren't usually about like great things happening. It's usually about not so good things happening. And then we feel worse because of them. can be interpretations of situations that don't include all the information. So usually it's just about one narrative or one way of thinking, but there tends to be like a lot of evidence that is missing. So we're not really getting a clear picture. We're only getting the awful stuff. And it can result in further negative emotions. We can feel obviously much worse when we get stuck in these thinking traps. I'm just going to list a few thinking traps. If you want to Google cognitive distortions, I think there is a list of 12 in total, usually like around, like the 11 to 15 mark me, but I think it's usually 12. So catastrophizing is something a lot of people do. This is just imagining the worst case scenario. For a student, this might sound like if I fail, it will be a disaster and I'll never recover. What I often hear from international students is if I don't do good on this one thing, I'm going to fail and then I'm going to lose my visa and then I'm going to have to move back home. And so there's probably pieces of information from that narrative and that trajectory that is missing that would actually change how we feel about the outcome. It's probably not going to happen, but we need to take a step back, bring awareness to the fact that we're catastrophizing and say, hold on, what is the truth here? Is this actually going to happen? And if I did fail, would I actually be able to cope with it? Because that's what anxiety is a lot of the time, is assuming the worst thing is going to happen, but also that I wouldn't be able to deal with it. There's something so inherently wrong with me. I can't deal with bad things happening in my life, which is probably not true. And I would argue that it's not true because you're here. And I would imagine you've not gone through life unscathed at this point. You've made it through everything up until now. You probably have more resilience than you think. But catastrophizing does not take that resilience and that skill into account. So it's really problematic and it tends to make us feel worse. All or nothing thinking. I love all or nothing thinking because I love doing this. If something's either this way or it's that way and there's no in between, either I'm a total failure or I'm a complete success and there's no room for error. So this might sound like I can't do anything right. So if one thing goes wrong, you get like one bad grade, you get some pretty negative feedback on your thesis. Oh my gosh, I can't do anything right. It's probably not true. It's just in that one moment, something did not go well. Does that mean that's who you are as a person? Probably not. If it's not perfect, it's worthless. Taking like a very perfectionistic mindset. If I don't do it up to this standard, then it's not worth doing. I shouldn't hand it in. Everybody will think I'm stupid. Just because it's not this way. Again, we're not taking all the information into account. It's probably not true. It's also just very mean. It's really hard to motivate ourselves through meanness. It tends to not work that well. Personalizing. So this is the difficulty seeing the role others play in problems. So sometimes we get stuck in this idea that like, oh, if this thing goes wrong, it's only because of me. It's like, well, maybe, but probably not. And again, we're not taking all the information into account. So taking an unwarranted amount of responsibility or blame for a negative situation or outcome. It's not wrong to give yourself responsibility. It's important to take responsibility, but it's also important to acknowledge all the players in a situation. And there's also a difference between taking responsibility and blaming ourselves. Blaming tends to involve a lot of shame. Responsibility is a little bit more neutral. It's objectively acknowledging what role did we have in this situation. I also love emotional reasoning because I love doing this myself. Emotional reasoning is the idea that if I feel a certain way about something, then it must be true. If I feel like a failure, then I must be a failure. If I feel stupid, it must mean that I'm stupid and everybody else thinks I'm stupid as well. Or as you can see by some of the examples, I feel incompetent, so I must be incompetent. It's the truth because I feel that way so intensely. Or if I feel stressed, so it's impossible to do anything. Just because I feel so awful, it must mean that I'm incapable and there's nothing I can do about this. This is a favorite one. I feel guilty, therefore I must have done something wrong. Sometimes guilt misfires. Actually, guilt misfires very often. Just because we feel guilty about something, it doesn't have to mean we did something wrong. And again, we're not berating ourselves for having these ideas. This is just a way to be curious. So now you can go forward and you can label these moments. If you find yourself doing that, like, oh my gosh, like I feel so stupid. I know my supervisor thinks I'm stupid. You can stop and you can say, oh, Aziza, that lady who talked like really fast in that presentation, she was talking about emotional reasoning and she told me to bring an awareness to it. We're not judging it, we're acknowledging it. We're acknowledging that it might not actually be true. And is there a different way we can actually approach this just ever so slightly? Unfair comparisons. This, of course, this one's pretty obvious. And I know a lot of students do this, just using unrealistic standards. I want to also point out with unfair comparisons, it's not necessarily comparing yourself to other people. It might be comparing yourself to yourself. Maybe you're thinking about what kind of student you were in your undergrad, or even in high school, if you performed like really well, or there has been no experience of you being a certain way, but you just like have these ideas that you are supposed to be up here, but you continually operate here. So you're comparing yourself to an idea that you have of who you are. And so that can be unfair because those expectations just might be so big and so wild that nobody would be able to reach them. And it doesn't mean they're stupid. It just means they're impossible to reach. So be mindful of if these comparisons are with others, or if it's maybe just an internal comparison with yourself. It can be really helpful if you're like a very cerebral, cognitive kind of person to look for the evidence. We were talking about ways of coping. Somebody mentioned thought records. This is basically what a thought record is. It's trying to find the evidence to suggest that something may or may not be true. But I want to point out, evidence-based thinking is not simply positive thinking. And this is something I see a lot on TikTok and social media. Looking for the evidence doesn't mean trying to make ourselves feel better by sprinkling glitter and cotton candy on stuff in our lives, because that's not unreal, or that's not realistic either. That would actually be quite unrealistic. The problem with going so far to the other end of that spectrum and thinking only positively is that it's not believable. And if something's not believable, then it's probably going to be ineffective. So we're actually just looking for objective evidence to suggest that something is not true. So if we go back to this idea of, emotional reasoning, if I think I'm so stupid, so my professor must think I'm stupid as well, or my supervisor must think I'm stupid. You can pause and you can ask yourself, well, where's the evidence? You don't have to tell yourself, oh, I'm the smartest person in the world, and I know my supervisor also thinks I'm the smartest person. Well, one, you're probably not the smartest person in the world, and that's not bad because I just don't think that exists. So we don't want to go on that end, but we want to just think, okay, has my professor or supervisor ever told me that I'm stupid? Have they done anything to suggest that they think I'm stupid? And so you could argue with me and you could say, well, yeah, Aziza, actually my supervisor did something really awful and they did tell me I'm stupid. And so my question to that is, well, do we want to take the opinion of somebody who thinks it's okay to call people stupid seriously? Because that seems more problematic than what they think of your actual intelligence or what your intelligence may or may not be. It's more problematic that somebody thinks it's okay to call somebody stupid. And it might not actually mean you're stupid. It might mean there's an issue with the person who's actually telling you this. So you can ask yourself some questions. Is this absolutely true? Are there maybe exceptions? Like, maybe I did get really awful feedback from my supervisor, but every other time my feedback is fine. Like, it's pretty good. And every other time people have told me great things. So there actually have been moments where this hasn't been true. Would my best friend or someone I love say this about me? Like, do they have this thought? Have they ever told me these things? Can I talk to them about it? What would you tell somebody that you love? Can you sort of like take a back seat and think, hey, like, how would I be saying this to my friend? Are there any possible alternative interpretations? Again, not positive thinking, just objectively, could something else maybe be going on in the situation? And am I minimizing important details or information? That's sometimes our cue to maybe even go talk to somebody in our life saying, hey, here's the scenario. What did I miss? Like, am I just like, blowing things out of proportion or making assumptions based off very little information? Am I missing something? And getting somebody to work through that with us. Challenging our thinking. Okay. This is very important for students because I hear this so often. Not students entirely, people in general, but I hear this a lot in my work with students. These very rigid, black and white ways of how they approach failure, how they approach success, progress, intelligence, use of your time, caring for yourself. Again, it's not bad. It's probably very protective. if you have very high standards for yourself, it's probably because you just want yourself to do well and you want yourself to be successful. But sometimes that starts to backfire. These expectations are so high. No matter what we do, we always feel like a failure. We never feel like we're making progress. We always feel like we're wasting our time and everybody else's time. It can be really helpful to, again, gently take a step back and ask ourselves, is my definition of failure so either or? Is it so black and white? Is it so like limited? I have no wiggle room as a human to make any kind of mistake. Again, we are not berating ourselves for having certain ideas about what these definitions or what these words mean. But it's really important to reflect on it to see if maybe there's a little bit of a gray area that we've missed. And if we can find the gray area, then perhaps we can give ourselves permission to be human in the process and be a little bit more gentle. Maybe we don't do things as well as we would have liked. You can create reminders for this. I really like the idea of coping cards. I've worked with a lot of folks who use like sticky notes, so stick them on the mirror, stick them on the doors, anywhere where they're going to like actually see them, and remind yourself of these ideas. Like if you have a certain cognitive distortion that always comes up for you, like maybe your cognitive distortion is that I feel stupid, so it means everyone thinks I'm stupid. Maybe it's time to write something different that feels very believable, very approachable, not just like positive puppy dogs and rainbows, but it's like, okay, I'm probably not stupid because nobody's told me I'm stupid yet, and I'm in a PhD or I'm in a master's program, and I probably have to be at least like a little bit smart to get into these programs. I couldn't have cheated the system. Can you write that down on a little sticky note and just stick it somewhere? You put it on your phone, you put a little bit reminder. What are some things that you need to remember to help keep this on track, to correct these ways of thinking? Again, not because they're bad, but because they're getting in the way of you moving forward with yourself. You can also take like a different perspective with these things. This is a little bit of a complicated looking graph. I'm not like the biggest fan of it, but it can kind of help us put into perspective what we need to do differently. So for instance, if you look at the letting go acceptance category on the bottom right for me, you'll see that it's a situation where we can't take an action and we don't have control. There is a therapeutic approach called dialectical behavioral therapy, and mindfulness has a huge role in this therapeutic approach. And there's this really fun term that I like called radical acceptance. Radical acceptance is what we practice when there is no action we can take. We've tried everything and we just don't have control over the situation. So we just have to radically accept that it is what it is. My favorite example with this is if, maybe somebody has passed in our life, maybe somebody's sick and they're close to passing. There's no action and we can't control it. So how do we maybe practice a little bit of gentleness, and how do we practice a way of accepting the fact that this is just an awful situation and there's just nothing we can do, but we don't have to fight it. So acceptance is not about approval. You don't have to love what's going on, but can you accept the fact that this is just the reality? And I really want people to be aware of the fact that this has nothing to do with really dangerous situations. If you're in like an abusive relationship, if your safety is compromised, don't be like, Aziza told me to practice acceptance. Like, no, that's a situation where you need to leave and go be safe. But other situations, you might have to practice some acceptance. Maybe we can do like ceaseless striving, but maybe that's not working for us. Maybe we can master the situation, but we also might feel really hopeless. We can control something, but maybe there's no action that we can take. Maybe it's about pursuing something that feels actionable. What can we just do differently? So it's about figuring out where you kind of fall within these categories and asking yourselves, like, is there maybe something I can do? Or maybe do I have to go into this category of acceptance instead? Self-care and compassion-based strategies. This is kind of my favorite topic. I'm being mindful of the time as well, because I want to make sure we have time for questions, because I think I see some questions in the chat. What is self-compassion? Again, something you may have heard on social media. Hopefully you've heard the good stuff or the accurate stuff. But if we start with just compassion itself, compassion involves sensitivity to the experience of suffering, coupled with a deep desire to alleviate that suffering. Okay, so it's just bringing in awareness to somebody suffering. We all suffer in some capacity, but it's also this desire of wanting to make it go away. I want to make this feel better for somebody. So self-compassion is exactly what it sounds like. It's actually being compassionate to us, not just to other people all the time, but directing that compassion inward, relating to ourselves as the object of care and concern when faced with the experience of suffering. So this is by a quote by Kristin Neff. If you're ever curious about Kristin Neff, she's like a pioneer in self-compassion research. She's quantified a lot of this information, which is great. It makes it feel more practical. So if you're curious about self-compassion, Kristin Neff is a great person to look up. She has a website with all this information on it. So when we're thinking about self-compassion, very often people hear it as something that is selfish, and I'm just thinking nice things about myself that aren't true, and nobody would say this, and I'm being kind to myself when maybe I need to be harsher on myself to get things done. That is not what it is. Self-compassion is just offering yourself a basic level of kindness and friendliness that you would maybe give to somebody on the street or the person at the grocery store checkout. It doesn't mean that you have to kick your feet up and drink soda and potato chips every day because that's just what you like, and that would be self-compassion. It's about bringing ourselves back down to a certain baseline of care so we can do things in our lives, maybe in a less stressful way. A lot of students think perfectionism and harshness and shame is effective for them in progressing. And I'm here to say that it's actually not. It is, for the most part, very ineffective. There's a lot of research about how perfectionism can be helpful in academia. So just having high standards, wanting to perform a certain way, that's okay. But the problem with perfectionism is that it tends to go down this rabbit hole of shame. And it's no longer that I want to perform really well and be thoughtful with my work. It's I want to be thoughtful with my work and do it really well. And if I don't, then I'm a loser and I'm a failure and I'm stupid and I'm all these awful things. And so what research actually suggests is when you start to go down that rabbit hole of shame and you start ripping yourself apart because you feel like you didn't do well, performance actually tends to decline. We tend to do worse. And a few of you, a few slides back, were saying when you feel stressed, you actually tend to procrastinate, which makes a lot of sense because if our work means that I'm always going to do poorly, which means I'm going to feel stupid, then why would you want to do that work? It's human nature to pull back and say, I'm not going to do this thing that makes me feel awful about myself. So again, you do not have to shame yourself for shaming yourself. It is probably quite normal that you're doing that. You can be curious about where you learned it, where did this come from? And just be mindful of when it comes up, like, is this true? Is this how I'm actually going to motivate myself? Is this effective or is it making me feel worse? Just bringing some little changes to it. Is there something different I can maybe see? Is there a different way I can approach this conversation with myself? So Kristin Neff, who's this pioneer in self-compassion, she says that there's 3 elements to self-compassion. So we already talked about mindfulness. So there is a mindfulness element to it. So it's bringing this, non-judgmental awareness to our situation. Self-kindness, again, is not selfishness. It's just treating ourselves this basic human level of kindness or friendliness that we would give to a stranger. How do we not call ourselves stupid and all these awful names? It's probably not going to help us perform well. We're going to perform worse, and then we'll feel irritated and agitated with other people in our lives. My favorite element is called common humanity. I think it's my favorite because it gets, I think, misunderstood the most. Common humanity is not comparing ourselves to other people. So oftentimes people hear common humanity as a way to compare to others to make ourselves feel worse. So thinking, well, these people over here have it worse than me, so I should feel good about my situation. That's not how the world works. People go through different levels of suffering. We all suffer in some way. The levels might differ, but someone being worse does not have to take away from your suffering. If that worked, none of you would be in this group right now. We wouldn't have to study these things endlessly. We wouldn't have to have conversations about them. That's not the point. It's about acknowledging that everybody in the world in some capacity suffers, and we are all in that suffering together. It's to reduce the sense of isolation that we typically feel when we're going through something really difficult. What tends to happen when we're going through something difficult is our world starts to get smaller and smaller. We tend to share less with people because there's shame. I don't want to tell people because I don't want them to judge me. I don't want to tell people because, what if they're going through something worse? And my problems really aren't a big deal, but they are a big deal. And I know they're a big deal because they're impacting you. And that's enough to prove that it is a problem. So it's just acknowledging that we're not alone in this process. It's not a method of comparison to other people in the world. There are lots of self-compassion exercises that you can do. Again, you can go to Kristen Neff's website. There's a Linda Graham one on this slide. Again, you're going to get these slides so you can go over this on your own. I'm just being mindful of the time. I want to make sure we can finish up and have time for Q&A. But Kristen Neff's website, it's selfcompassion.org. You can find so many self-compassion exercises, and I've heard really great things from other people. I've used some of them as well. They're very well done and they're very practical. So it doesn't feel like you're kind of going down the road of like self-love and things that just don't feel natural to you. They're much more practical and approachable. So if people are comfortable with turning on their annotate feature again, make sure you click the text option at the top left, or you can put it in the chat and I will read it. I'm just going to rejig my screen a little bit so I can read this correctly. So explore the idea of treating yourself as you would a good friend. How do you respond to important people in your life when they are going through a hard time? What comes to mind when you think about people that you love? What do you say to them? And you can even share, like, what do you say to yourself, but it does not align with what you say to people in your life? Anything come to mind? You can also answer the second question. If you were to make a self-compassion coping card for yourself or someone you love, what would you include? What are some statements? What are some activities? What would you put on these things? So 2 questions, they have a lot in common. What would you say to somebody? And if there's something new that you learned today, what would you maybe add to that? I'll keep an eye out in the chat as well. Anything come to mind? Listening carefully. Yeah, listening is like the most powerful tool that you have. It's just letting people know that you care and that you hear them. Yeah, reminding people of their accomplishments. Sometimes people need to just be reminded that, like, you actually have done great things. Like, you're not a loser the way you're telling me you're a loser. You're doing great things in your life. Giving a hug, absolutely. Don't rush, take your time. Yes, there's nothing worse than when you're going to talk to somebody. I know doctors do this very often, no shade on doctors, but you get rushed through saying something and then it just feels like they don't really care all that much. Take tea and offer an ear. I love this. There's nothing more comforting than someone giving you like a warm cup of tea to hold while you talk to them. Positively affirming, absolutely. So again, like reminding them of things that they're maybe not able to see in that moment. Anything else? How do you typically respond to important people in your life when they're going through a really hard time? Something I like to do, I like to actually just sit in the fact that the situation is hard and it sucks. I find that to be effective even for myself, to be like, yeah, you know what? I'm not going to feel better about this because I'm not supposed to feel better about it. And I say that to my friends too, and they know when they come to me, I'm not going to make them feel better. I'm not going to say like, oh, everything's fine, life is great. I'm going to say, yeah, this is a really unfortunate situation and it would be hard and it would be really upsetting. I wouldn't expect you to actually feel good about it, but what can I do while you go through this really hard transition or you go through this really hard situation? Like, what do you need me to do as a friend? I'm just going to jig my screen around. So make time even when you cannot find it. Yeah, absolutely. It's taking a little bit of time for somebody, a little bit of extra time. Somebody wrote, I may not understand you, but I'm here because I care about you. Absolutely. Sometimes we don't have to understand. As a therapist, I don't always understand everything that somebody's telling me because I haven't personally experienced it, but that's not what's most important. What's important is me trying to understand. Yeah, pay attention to the person. Absolutely. Really letting people know that, like, I'm here to listen. Okay. I see like a thank them for trusting. Yeah, absolutely. just saying, thank you for telling me. It's an honor when somebody tells you a secret or tells you what is going on in their life that's difficult. It means they really trust you. Okay, we're going to wrap up because we're due for time soon. So I'm going to clear these responses. They're all fantastic. Thank you guys so much. Okay, so we're going to go back to the basics for our last few slides. The reason why it's helpful to go back to the basics instead of like these cognitive distortions and mindfulness and relaxation techniques is because these tend to be the things that people forget about because they seem really basic and we tend to not really notice them because maybe we do them often, maybe we just don't do them at all. And we think, oh gosh, I'm going to pathologize myself. And it's probably because I have all these other problems, but really it can be helpful to just go back to very basic things that we can do in our day-to-day life. Movement is one of them. I know somebody earlier was mentioning exercise for coping with their mental health or their wellness. Again, research over and over again suggests that movement and exercise has a massive impact on our mental health. It's not one of those things where you can like bargain with it and say, oh, I just don't really like doing it. If you don't do it, you probably won't see many changes in your life. And I encourage you to try to explore ways of having a healthy relationship with movement because, again, socially, we tend to view movement as exercise as something related to like weight loss. That's not the point. If it even means just going for like a 20-minute walk, even when it's kind of cold out and look at the pretty snow, like maybe you want to try a new park in Toronto, maybe you want to go walking with a friend or go just walk to a new coffee shop and grab a cup of coffee, finding a meaningful way to move your body. Again, not with the intention of weight loss, but to just get yourself out of the house, for instance. Again, I'm cautious about nourishment because I don't want people to sort of see this as, oh, we have to eat healthy and it's for weight loss. That's not the case. Cheetos are a part of a balanced diet. Don't quote me on that. Pizza is part of a well-balanced diet. But if you're only eating pizza and Cheetos for like breakfast, lunch, dinner, you're probably not going to feel really good. You do have to pay attention to how you eat and you do it mindfully and in a balanced way. You make space for Cheetos and ice cream and pizza. Those are not bad things. But again, if you're not able to nourish your body appropriately for what your needs are physically, you're probably going to notice the effects of it. There's also a lot of research on mental health and like certain vitamin deficiencies. It's been proven over and over again. So it's just bringing in awareness to it. We don't have to shame ourselves. I know students get busy. Everyone gets busy. We kind of forget about our eating habits, but it's something that can be helpful to bring some awareness to and to make some minor changes if you feel like you need to. Sleep. I cannot emphasize sleep enough. There's a lot of research on how I think it was something, I'm not going to like say it properly, but it was something along the lines of how like most mental health conditions are related to a lack of meaningful connection and sleep disturbances. I don't know about you, but if I don't get 8 hours of sleep, I'm an 8 hours kind of gal. I'm irritable, I'm moody, I cannot pay attention enough, I don't have enough focus the next day, I feel awful. Some people can get away with 5 hours, so it's not to say you have to get 8 hours. Get as many hours as you think you need to operate to whatever level you like to operate at. Be mindful of things like sleep hygiene. Sleep hygiene is just the stuff that we do when we gear up, when we get ready to go to bed. Do you turn off your screens an hour before bed? Do you drink a warm tea? Do you put some nice clean pajamas on or loungewear? Do you take a warm shower, a warm bath? What is it that you do to wind down? It's also very important if you can do this, because I know not all students have the space to do this. If you can make sure you do not work in your room or in your bed, that will also help with sleep if you're having issues. Because what starts to happen is your brain starts to make this connection with your bed. All of a sudden, your bedroom is a place where we stress and where we do work and when we think about all the things that we need to do the next day. Rooms are only for two things, sleeping and sex. That's it. Getting changed, of course, but it's not doing work. It is also actually suggested that if you can't sleep, you give yourself about 15 minutes and then you get out of bed. Don't turn on any bright lights. Go to the couch if you have a couch, if you can, if you have the space to do it, of course. Read like a microwave manual, like something really boring. So you hopefully start to doze off and then you go back to bed. What we're trying to do when we do that, every 15 minutes you get out of bed if you can't sleep, is we're trying to sever that connection we have with our bed. That my bed is a place where I stress out and I feel anxious about not being able to sleep. That's where I feel anxious about my day or my next day, whatever it might be. So it's about really curating a section of our room in our lives where we only do sleep. If you're one of those folks where you're only renting your room and you have no other space options, I've worked with people who have set up like little curtains around their bed. So when they go to sleep, they don't see the rest of the room. They just see these curtains, and the bed is not a place where they do work anymore. So there are ways to work around it if your space is limited. Physical health, again, it's so basic, but if you're experiencing physical symptoms of like an illness or just something not good, please go talk to a doctor. It is not going to help your stress if you are worried about your physical health or you're having symptoms to the point where you feel like you can't do your academics anymore. There's accessibility services. So if you do have a physical health condition that's making it hard to do your academics, you can get some accommodations, but please check in with a doctor, especially for an international student, you don't have a family doctor here. Please try to find a walk-in clinic that you can go to so you can get some things checked out. Really, all in all, it's about creating balance though. I know a lot of students feel like they have to study and do work for 8 hours a day, and there's no way around it. My thought is you're probably not actually working for 8 hours. You're probably working for the 4 out of those 8. So you do have time to do these things, but it's about doing them intentionally and mindfully. If you like going on your phone and scrolling, but you're like doom scrolling or you're like stress scrolling because you know you actually have to do work in the back of your head, set time aside to scroll through your phone. It's important to incorporate breaks. Again, lots of research on this. There's actually this really fun piece of literature that studied students who studied for 8 hours and students who studied for like 3 hours, but they incorporated breaks in those 3 hours, and the students who studied for like a fraction of the time ended up doing significantly better than students who studied longer. So it's really important to create a life outside of school with all of these things if you can. Again, you're going to get distracted and burn out anyway, so you might as well give a little bit of space to these things with more intentionality. Creating connection, trying to make friends, meaningful relationships, keeping in touch with family members. There's a lot of social activities that York puts together for their students, so keeping an eye out for those things, sporting events if you want to do that, joining like an intramural league if that's what speaks to you, but finding a way to connect with other people. Again, literature over and over again says like what strings together most mental health conditions is this lack of connection with other people and a sense of isolation. I'm being mindful of my time. I feel like Inessa's is sending me updates. I only have like maybe a couple minutes left. There are lots of resources at York. Again, you're going to get these slides, so I'm probably not going to go over all of them in detail, but I'm just going to highlight a few. Okay, we have grad student wellness services. So we have 3 services in particular. We have a consultation and counseling clinic. This is where I work. We have a student named Ruth who offers counseling as well. We also have an initiative fund. So if you do want to pursue something that has to do with mental health or wellness, you see a gap in the York grad community, we have up to $1,500 that we can offer you to actually do those initiatives. We also have a certificate in personal wellness and learning skills. So consultation and counseling service, fast access, very easy to book, totally free, totally confidential. If you remember nothing from today, except that there's a counseling opportunity at FGS and you Google it and you come across this, you've come to the right place. You don't have to go through an admin person. You just book through our portal. It's really easy to do. If you need to cancel and reschedule, you can do that on your own as well. You don't have to send emails or make phone calls. So it's a very user-friendly process. Again, we have a certificate in personal wellness and learning skills. We're going to talk about the things that we talked about today, but in more detail. You can still sign up for it. We're actually starting next Tuesday. And we're doing 5 sessions. We're skipping reading week though. And we do this with the Learning Skills Center. So we're going to talk about things like procrastination and motivation, but also all the stuff that we talked about today, but again, in more detail. Student counseling, health and well-being. This is the main counseling hub at York. So just so you know, I'm not the only counselor that exists. Student counseling, health and well-being works with undergrad students and grad students. They have about 20 counselors to choose from. So there's just more to pick if you feel like I'm not a good fit. Again, student accessibility services, if you have a mental health concern, if you have an attention disorder, if you have a physical health concern that's impacting your ability to do your academics, you can get accommodations through student accessibility services. This is not accessibility services determining if you are allowed to get accommodations. It's your legal right to get accommodations if you do have something that's impacting your ability to do school. There's also workplace accessibility if you're working for York. There's a couple phone lines you can access as well, so there's Good to Talk. I think there used to be another international phone line, but I don't think it's operating anymore, but this is for post-secondary students in Ontario. And there's a few other places as well. Again, you're going to get a copy of these slides, so you'll be able to explore some other services that you do have access to as a student, and some emergency and crisis support options. If you are in a crisis, there is 911, and there's many distress lines in Toronto that you can access as well, and it's all for free, and they usually operate 24/7. This is my manager's info. So if you do have a question for us and you want to email us, you can email her. You can also email us at gradwell@yorku.ca.